I'm here to talk about home safe and well. So this is a concept that we came up with, and this is a way to bring health and safety and the wellbeing messages together. And it's very much about getting into the hearts and minds of people. So we've done this quite a bit with safety, but it is very much around working the wellbeing messages in. So what's important to people? Why do they want to go home safe and well? This is one of our traffic officers. And obviously this is her with her family. This is an image that has become synonymous to our Home Safe and Well campaign. And on our document we have a picture of her in a vehicle, and then we have a picture of her at home. And it is very much around those messages around why do you want to stay healthy and well. And it's getting into the hearts and minds of people. And we've done this around why do you not want to get injured, but it's now extending that into the wellbeing arena. So one of the things that we did was we asked our employees to share pictures of what is important to them. What do they want to go home for? What is important to them that they want to stay well for? So yeah, we got loads and loads of pictures, everybody sharing their pictures. And in the middle there, we've got a board that is actually at one of our outstations. And we know we've done well when this picture in the middle, you'll see two kids kissing, but they're actually in pen on there, somebody's written, worth it every day. And we know that that's what we wanted to get to. And it's keeping those things that are important to it in your mind all the time. But it isn't just a concept. So Home Safe and Well is a brand, and we worked very much on getting the brand out there and connecting with people. But actually, Home Safe and Well is all around these things. So we've got buckets underneath, and we apply these to safety and well-being. So it's about making sure you have effective leadership. And this is, making sure that people follow procedures, but this is making sure that our managers have the right conversations with people and they understand not just the safety impacts, but the health and well-being impacts. We have capable people, so we make sure that we do training for our managers, but also for our employees. We set very clear expectations. So what is expected of people? We engage with our stakeholders, and we're starting to talk about what the measures around health and well-being as well as health and safety with our stakeholders. Very much around learning as well. So we do this within safety. So we're very familiar with investigations, with safety. You don't do so many around health and well-being, and this is something that we are starting to do. So when you have a work-related ill health, why don't we investigate it the way that we investigate an injury? So we're starting to do that. And the other thing is around a known blame culture. So we want people to have open, honest conversations. We want people to tell us stuff so that we can learn. And then it's all around design. So all of our processes, the jobs, you've got to have a health, safety and well-being lens on it whenever you're planning anything. If health and well-being should be in 3 buckets. And the majority of the time we concentrate, and a lot of people have concentrated on the individual and how we change an individual. But actually, we've got 2 other areas that you really need to focus on, which is the organisation. So how do we set the processes right to enhance well-being? And then you've got manager. And manager is a key role in the health and well-being of individuals. So we've talked a little bit about this before, which is what is health and well-being? So often, these are the images that still people associate with health and well-being. And actually, this can be quite scary for people, but this is the thing that I get associated with in my job. And the majority of things that people ask me for, when I say, what's going to improve your health and well-being, loads of people say, discounted gyms or free fruit. So then I push back, actually, is that really going to impact your health and well-being? So how many people have got gym memberships, but do you go? How much is it actually enhancing your well-being? But still, people are very much think health and well-being is this. Whereas actually what we're trying to do is get people to understand that health and well-being is more this. It's the stuff that you do that enhances your life. So you don't have to don lycra to go and do exercise. You can just go out for a walk. It's about having time with family. Sometimes it's about spending time on your own. It's, you know, if you love gardening, that's the kind of thing. I've got somebody driving on there because you can't have good health and well-being if you don't feel safe. That's obviously really important, and this is why the two are intrinsically linked. You cannot have good safety and feel good well-being without feeling safe. And then the picture underneath that, this is one where we kind of, I don't like the term happy, and we use happy a lot, but happy is an artificial term because we are not happy all the time. So a term that we prefer to say is content, because we need to be content that happiness, you know, everybody doesn't go around smiling. We all have bad days, and it is the thing around recognising that we have bad days, but we're content because we know that we have the support around us and that we know that the bad days will fade and that we'll get better. It's about the content, and that's what we've been working towards. We find happy often goes against mental health sometimes because people feel I'm not happy, I'm not right, but you know, everybody has good mental health days and bad mental health days as much as physical health, good and bad. So I think, yeah, content is a word that we started to use. And actually using content, what you find nowadays is, I've got 2 teenagers and they're very much into social media. And when you look at social media, what is posted on there? The best, your perfect life, isn't it? It's not real. And actually what we find is, you know, with my teenagers and some of their friends, is like that comparison of, it's not keeping up with the Joneses anymore, it's keeping up with the whole world. So we're very much around that playing on that content, and it's being content with what you have. One of the things that we used, and I've used this in the previous organisation as well, is the Workplace Wellbeing Charter. Can I have a show of hands? How many people are familiar with the Workplace Wellbeing Charter? Not many, okay. So it was commissioned in 2014 by Public Health England, published it, and it is a set of standards. Now it does have some limitations, but it does set out a set of standards that are evidence-based, and it provides a systematic evidence-based approach to measuring well-being. So there is 98 standards across the 8 different buckets you can see in there. And it sets out some key basics, and it is a really good place to start. Like I say, it doesn't cover everything, and it does have some limitations, but I do think it's a great starting place. And if you can get the basics right on here, then you've moved yourself into a good place. So what we've done is we've benchmarked ourselves against those standards within the Charter to understand where we are. Now, green on there is that we've fully met the standard, amber is that we've partially met, and red is that we haven't met the standards. And we're talking to our supply chain to use this as a way to benchmark about where we are. The Charter also has 3 levels. So you have commitment level, which is essentially your bronze. So that's the basics, the real basics to get in place. Then you have your silver level, which is achievement, and then you have excellence. So yeah, it's a way to kind of, it helps to set your priorities as well. So if you want to, you know, get all the basics right, then move up to the next level and finally up to the excellence level. So it does help you to prioritise and set a plan as well. So how do we measure success? Well, the thing that most people in terms of health and well-being is they look at absence, because absence is the easiest thing to measure. Most people will record absences, but actually absence really is the tip of the iceberg, and we should be looking at productivity, but it's a lot harder to measure productivity. So people, mainly do stay with the absence because that's the thing that is easier to measure. And obviously there are certain jobs where it is easier to measure productivity than other jobs. So what are the success measures? And these are the things that investing in health and well-being should give an organisation. So it should give you increased productivity. So we should try and measure that. Health and safety. So if you get health and well-being right, as we were saying before, the accident rates have become static, and health and well-being is a way to actually drive down your accident rates. So we do need to use accidents, and this is about beyond zero and the next phase of health and safety. Employee engagement. So your engagement scores should increase if you improve your well-being. And an engagement survey is a great way to actually start asking some questions around health and well-being. So I don't know how many people do engagement surveys, but have a look at your question set, and are you actually using the opportunity to put in some questions around well-being, because it is a really great way to start to measure, and putting some measures in there around your manager's capability and how they feel. Does their manager care for them? So some measures around their culture within the organisation is useful. If you improve health and well-being, you should make it a great place to work. So you should retain staff, and you should also attract. So that's another measure. How many people are leaving your organisation? How many people are joining? Are you attracting talent into the organisation? But that's one that you can measure, is your attrition rates. And then the last one is innovation. So innovation is something that goes once your well-being deteriorates. Innovation is one of the first things to go, because it's not an essential function. So, when you're just getting by, you can't actually have the spare energy to be innovative. So can you measure the innovation that's coming out of people? Because that is another way to measure good health and well-being. I'm going to talk a little bit about leading and lagging measures, and I know we use these a lot in health and safety, but I don't think we've got it right yet in terms of health and well-being. So I'm just looking here at mental health. So mental health, we want to reduce mental health absence. So how do we think we might want to do that? And obviously that is your lagging measure, is your absence. And people often get confused about what leading and lagging measures are, but basically a leading measure is just basically, I think that if I do X, I will reduce the mental health absence. So what is going to lead to you reducing the mental health absence? And they're your leading measures. So we started sharing stories. That's an important way to reduce the stigma. But how many stories did we share? How much interaction did we get with the stories? There are ways to measure it. The next thing is we put in mental health first aiders. So number of mental health first aiders. But number of mental health first aiders doesn't really tell you much. What you need to do is actually, how effective are your mental health first aiders? And not many people are actually doing that. Lots of people have put mental health first aiders in, but not many people are measuring the success of their mental health first aiders. So what we start to do is record how many conversations are they having, where are they signposting to, what are the issues, are the mental health first aiders confident? So you start to measure the effectiveness, and then you see the reduction in mental health absence. but you need to make sure that the things that you're putting in are actually successful. And the way that we do the mental health first aid measuring the conversations, it's really simple. It's an anonymised form, so we don't put any details about an individual in there. We use Microsoft Forms. So the mental health first aiders, they only see the front. It's like a survey that they fill in. It's just got a series of questions, but it does not at all identify the individual that they've spoke to. But yeah, it's a series of questions. They don't see any of the backing data, and it just comes through to us on an Excel, so we can go in and pull all the data off. But it is quite a simple way to do it. And you can start to, so this is, I've only been in highways for 5 months, so I haven't really got many results to share from highways yet, but this is from a previous organisation. So I used to work for United Utilities. And this was some of the data that over 4 years, you know, I saw improve. So we do medicals. We do medicals on people. We do the, you know, we did the kiosks, you know, the kiosks where you can go and get your health metrics done. So we gather that data, again, anonymised data, but it's about looking at what is the health of your organisation. So we reduced our obesity rates, so they went from 1 in 5 to 1 in 6. We looked at work-related stress, so people who'd reported any work-related stress symptoms went down from 66.7 to 50.7%. And this is not that they've been absent, this is that they have reported some symptoms from time to time. So we're seeing the reduction. Smoking rates drastically reduced, down from 14% to 5%. We looked at, are people getting enough exercise? And again, we reduced that quite significantly. But one of the key ones is this one. So mental health absence per occurrence. We were finding that intervention was late, and I found this exactly the same joining highways. So in highways, 37% of our absence is due to mental health, but 30% of referrals are being made to occupational health or any intervention after somebody's been off for more than 5 weeks. There are a lot that are happening whilst they're in work, but 30% are happening when people have been off for 5 weeks. When somebody's been off work for 5 weeks, that condition potentially has become chronic. If we'd done earlier intervention, you get people on the road to recovery much sooner. So this was something that really focused on in United Utilities, and we looked at the length of absence. So this could be another measure for you. It's not just the absence, it's by reason, it's by length of occurrence. And we reduced it from 14 days to 8 days, which is quite significant. And our employee engagement scores did drastically increase. So yeah, it's just a flavour there of some of the measures that you can start using. And there are loads out there. So, and it's about what do you want to gather, measuring the success of your interventions and things that you put in. A lot of the time we do use these fads, but actually what is it that you're trying to achieve? And think about that. What is it that you're trying to achieve? How are you going to measure success? So when you put anything in, think about why am I doing this, and how am I going to measure the success of it?